Joining us on this segment currently is going to be Benjamin Geyerhahn, and he's actually the CEO and the founder of Benestream. And as we mentioned, Benjamin actually works with employers on helping them really navigate the employee mandate.
Hey.
Good morning to you, and welcome to the program. Kind of give our audience a feel for Benestream and what you do, and then we'll kind of dig a little further into this employer mandate that's coming up.
Sure. Well, we do one element of this, one piece of the pie for those folks who are facing mandates. We deal with a low-income workforce, assess whether or not that workforce is Medicaid eligible, and then enroll them in Medicaid if they're eligible. And what that does is, of course, employers are mandated to offer health insurance, and we can talk about that, how that works. But typically, in the low-income space, Medicaid is going to be a much nicer solution, a much more robust solution for the employee. So if they're enrolled in Medicaid, they will quite often say, thank you very much, I'm not interested in the insurance that the employer's offering, and that saves the employer a bunch of money. That saves the employee the cost of the premium copay. So it's a win-win situation.
So Ben, you're actually doing the legwork for both the employer and that employee, correct? To find out.
I'm sorry, I'm having a little trouble hearing you, actually.
Can you hear me now? You actually are doing the legwork for the employer and also those employees by communicating to them who is eligible and the benefits that they become eligible for.
That's right. We come in and we have a conversation with every employee we think might be eligible and tell them the value of the Medicaid program, and then we work with them to go through that process. Enrolling in Medicaid, unfortunately, is difficult. It requires that you gather a lot of information, and it's not information that's especially complicated, but it's not things one knows right off the top of our heads. I don't know my kid's social security number, so it's the kind of thing where you just have to be prepared, and that's really where our work comes in. We help everyone prepare, and then we walk them through the process.
Well, I think you just answered my next question. That is, why can't employers do it themselves? It takes a knowledge base and good resources to do this. Correct?
It does. It's just the kind of thing that it's a little bit like doing your taxes. Can you do it? Sure. It'll take you a couple hours. Is it a lot easier if you use TurboTax or if you want a little more hand-holding, you go to H&R Block? It's a lot easier, right? Just because, look, government forms are complicated. Governments are not great at making things simple and easy for us. And so any situation where, someone who is an expert at the process can come in and provide you assistance, whether it be for us, Medicaid, or for, taxes, H&R Block, it's going to add a lot of value, and it's just also going to relieve the anxiety you feel when you get asked 60 questions by a government entity.
Ben, when did you roll this out to employers? When did you start doing this?
We started doing this at the beginning of this year. We like to say that we started when the exchanges were working well. So, as you know, they didn't run smoothly at the beginning. In our estimation, February of this year was about when things were working well, and that's when we began rolling it out. And we started with sort of fast food places, and now we're in a number of different sectors.
Now, Ben, when you had mentioned, you help with the hand-holding process with the employer, but on the employee side of this, you also help with the hand-holding. With the employees, how do they, aside from the hand-holding process, what other benefits does the employee see?
The employee?
The employee, yes.
Yeah, the employee, the benefits for the employee are, at the end of the day, getting Medicaid and the process of not having to show up at a government office. So let's talk about a little bit about who we work with. We work with people who typically have children and work a 40 or 50-hour week.
Yep.
For them to go to a government office, they're going to spend all day online. They're then going to be not treated, not poorly, but they're going to be treated not wonderfully. And they're losing time with their kids that they could be doing something else. What really, for us, one of the really satisfying things for the folks who do this is that the employees are really appreciative because you basically, the employer has saved them a day of aggravation. And at the end of it, they get great benefits, which we also actually help them with a food stamps application and a what's called a Lifeline phone application, which is a sort of a monthly phone.
So you are saving the employer money Also creating some goodwill for the employer with the employee population, because the employees are actually getting, in a better benefits package, complete benefit package, including food stamps, et cetera, correct?
That's right.
Yeah.
And it's family coverage. I mean, I think one of the things that employers are struggling with these days is, at this end of the spectrum, no one, and this includes the best unions, is really offering coverage to the entire family. They're offering individual coverage. And Medicaid is family coverage. And I think that's something that, employers take some level of pride in. And frankly, is a really big deal for their employees. Because when we talk, again, our population is largely families. And quite frankly, is often single families. And for these parents to ensure that their children have coverage, I mean, I have kids, this is the kind of thing that keeps you up at night if you don't have insurance for those kids.
Yeah. Hey, Ben, what is your business model for employers?
So the employers pay us $40 for every single individual we screen, and we screen everyone who makes less than $33,000 a year. The $33,000 figure comes from $33,000 is the threshold for Medicaid eligibility for a family of four. Mm-hmm. So we screen everyone in that range. About 25% of those folks end up being enrolled in Medicaid. For everyone who gets enrolled in Medicaid, we charge an additional $200. Mm-hmm. That is spread out over 10 weeks, and what it really becomes is $20 a month. The reason we price it that way is that there's an incredible level of turnover, and our clients, that's the employers, the businesses, said, look, I don't want to be paying. I don't mind that this person has the benefit after they leave me, but I don't want to be paying for it. So, if they leave after 6 months, the employer has only paid, $120 or so for that benefit.
Now, Ben, let our audience know, if I'm an employer out there, how do I get started with your services? Is it as simple as reaching out to you and inquiring? How do they do that?
Sure. I mean, so they can send me an email. It's really simple. It's ben@benestream.com, or there's a way to go on our site and contact us. Or in many cases, their broker will be carrying this product. Mm-hmm. We work with brokers across the country, and we like to be part of a comprehensive package. So probably start by asking your broker, and then the second thing to do is just send me an email.
Now, in the last minute or so we got on the program, the healthcare law is pretty complex, and give our audience kind of one or two key takeaways on how your services can really help them as they look at this healthcare law.
Our services will save. If you are operating in this space, our services are going to save you a lot of money. The value proposition we're seeing, is you're getting about a 10-to-1 punch for your dollar, just because in this low-income population, the cost of our service, $250, is significantly less than the cost of insuring them, which ranges from $600 to about $8,000 on an annualized basis.
And that's per employee that is not qualified for what the healthcare law mandates as eligible coverage, right? Or actually the mandated coverage?
Right, the mandated coverage. Well, the mandated coverage or the minimum essential coverage plans. I mean, in many cases you're going to have to either provide health insurance or you're going to have to offer health insurance, but also to meet your participation levels. In some cases, we're seeing people who are just giving coverage to their low-income workers. The cost of that's going to cost is somewhere between $600 and we've seen as high as $15,000 on a per-person basis, and we save that cost.
Well, Ben, hey, we really appreciate you joining us on Healthcare Consumerism Radio this morning, and to all the employers out there and brokers out there, please do reach out to Ben about his services and what he can do to help you, get people actively covered, as you deal with the healthcare law. And Ben, again, thanks so much for joining us. Have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.